basement. We're gonna see what's happening here. Don't be frightened, any of you. Hi, guys. Oh, beautiful. You know how to do the Xbox? How cool. Okay, great.
Yeah.
Pediatric area. Diagnosis. You did it! Wow! Okay, now I'm going to change it to my costume and I'll see you guys later. This is the pediatric area. Come on up and see the young adult. Okay, this is main reception. We like to call it the reception area, not the waiting area. Hopefully you don't wait that long. Come on and see me. Hygiene. Serious restorative area where we fix teeth. A young adult orthodontic area. This is where we use removable appliances to move teeth around. Before braces, way before, and maybe to avoid braces. That's what we do here. This is where we do radiography and our fixed orthodontics. And I'll change and I'll see you guys later. Hi guys, and fellow tribesmen. 1230 Club has known me for a long time, and this is probably my second presentation on pediatric dentistry. The definition of pediatric dentistry is quality general dental care for children. Whatever you would do for an adult, you might want to translate that over to children. We don't consider that it's baby teeth, they're going to fall out because they never do, and when there's a problem with baby teeth, boy, comes a whopper. Now what we do in pediatric dentistry is we assess and evaluate the children, whether their behavior is amenable to treatment, or if they're frightened, or fearful, or shy, or hysterical, or incorrigible. We label the children 1 to 5. Normal, shy, frightened, hysterical, incorrigible. We use sedative medications to relax children so that their perception of what goes on is minimized. And sometimes pain perception can be minimized by relaxing someone. We use local anesthesia, regional anesthesia, and we have the most dynamic part of growth from birth to 12 years old. There's so many tremendous changes in the mouth and in the skull and this dentition and in the skeleton. You know, it wasn't too long ago when I showed a director of a certain local hospital the pictures of this office and this particular demo model. This particular director thought that children would be afraid of this kind of approach. Our approach is we don't hide anything. Everything is shown to the children. We use mirrors so they can see what's going on. If they raise their mirror, we listen. We tell them we love them, which is true. And we don't think that things like this should frighten children. We think things like this will illuminate children. There's nothing like education. Like my mother said, an education is worth more than gold, because gold and silver will wither away, but a good education will never decay. Decay? Teeth? Maybe. So, in the dynamics of taking care of kids in cavities, when you have cavities, you lose space. When you lose teeth, you lose space, and that all leads to orthodontic issues. And this is probably the old fashion, and the new fashion now is clear aligners. before we do things like that, we do things like this. We change the shape of the jaws by having fun with colorful, interceptive orthodontic problems, and then later on go on to using other kinds of dynamic systems which move teeth, which people are not aware of. I still enjoy what I do. I come to work excited every day. The challenge of trying to educate kids and making them your friend and disciplining them as well is a great pleasure for me. I have a great staff and we work together as a team, and we try to educate parents as well. It's kind of hard to do both at once, so we kind of favor the child. We're here as advocates of the children. If their parents don't understand, that's too bad. But we only do the correct things. And that's about the story. We'll talk to you more in person.